When a stroke occurs, every minute becomes a silent enemy. With each passing moment, the brain can lose millions of neurons that will never come back. Just imagine what that means. In only a few minutes, essential abilities like speaking, walking, remembering, or even hugging your loved ones can be affected. And many people don't realize this, but identifying a stroke early can make the difference between fully recovering or facing long-lasting complications. Today, I want you to clearly understand what you can do to protect your brain or the brain of someone close to you, because there is a very real opportunity to act. We have what is known as a critical window of about 4.5 hours. During that period, modern medicine can offer treatments that, years ago, would have seemed impossible. But for those treatments to work, one thing is essential: recognizing what is happening and seeking help immediately. Stay with me, because I'm going to guide you step by step. I'll explain how to identify the signs of a stroke and how to act safely while waiting for professional help to arrive. And most importantly, I'll tell you what you should never do. What you learn today may help you save someone you love. I'm Dr. Gabriel Mena. I've spent many years working in emergency care and medical consultations, and I've seen how a stroke can change someone's life in a matter of seconds. I've seen families dealing with sudden speech loss, paralysis, or confusion that comes without warning. But I've also seen the opposite. I remember Mr. Hector, a patient who arrived at the hospital just 30 minutes after his symptoms began. His wife reacted quickly, sensed something was wrong, and asked for help without hesitation. Because of that, he received treatment on time, and today he is still walking, talking, and enjoying his grandchildren. Stories like his prove how crucial timing is. In the end, the difference between a good recovery and severe damage often depends on one thing: knowledge. That's why I want to give you the tools you need so you know what to do without panicking. When you have a clear plan, fear decreases and your ability to act increases. Welcome to my channel. Here we talk about complete health, longevity, and natural, simple habits that help you stay balanced physically, mentally, and emotionally. So take notes and share this with your family and friends to help them improve their health. We upload new videos every day, so subscribe and activate the notification bell so you don't miss anything. Before we continue, if you find this content helpful, a simple gesture like liking the video or sharing it helps this message reach more people who need it. Thank you sincerely for being here and taking care of your health. Now, let's go deeper into the topic. Before I explain how to detect a stroke, I want you to understand what happens in the brain when one occurs. Think of your brain as the control center for everything you do and feel. To function, it needs a constant supply of blood carrying oxygen and nutrients. That blood travels through arteries that work like very thin, delicate pipes. A stroke occurs when that flow is interrupted. And this can happen in two ways. The most common type, representing the majority of cases, is an ischemic stroke. In this situation, an artery becomes blocked because a clot obstructs it, preventing blood from reaching a part of the brain. When that happens, neurons begin to die quickly. It is, in simple terms, a heart attack occurring inside the brain. The other type is a hemorrhagic stroke. Here, the artery doesn't get blocked, it ruptures. Blood spills into the brain, and besides not reaching where it's needed, it creates dangerous internal pressure. It's like a flood damaging everything in its path. Even though the causes differ, in both cases the outcome is the same: neurons die, and vital functions are lost with them. That's why we often repeat a phrase that isn't just a saying but a medical truth: time is brain. Every second we lose without acting increases the damage and lowers the chances of recovery. But here is the hopeful part. Science has proven that if we act within that several-hour window, we have treatments that can dissolve or remove the clot and restore blood flow to the brain. If you reach the right place in time, you can greatly improve your chances of recovery. Your role in this situation is not to become a doctor. What you need is the ability to recognize what is happening. To be, as I like to describe it, a time detective. And for that, we have a very useful tool. It's called FASTO, an easy-to-remember acronym that helps you identify the signs of a stroke without hesitation. Doubt is dangerous because it wastes precious time. That's why I want you to memorize this method. F stands for facial drooping. Ask the person to smile. If one side of the face does not move well, if the smile looks uneven, or if one corner of the mouth drops, that is an alarm sign. S stands for altered balance. This is not the occasional dizziness from standing up too quickly, but a sudden loss of coordination. The person may walk as if disoriented, stumble, or be unable to stay standing. S indicates sudden weakness. This weakness usually affects one side of the body. To check for it, ask the person to raise both arms with their palms facing upward. If one arm starts to drop and they can't stop it, it's a very clear sign. T refers to trouble seeing. If someone suddenly loses vision in one eye, sees double, or everything becomes blurry, it's a reason to suspect a stroke. Before we continue with the rest of the method, I want to pause briefly. If this content is helping you, I invite you to subscribe to the channel, because here you'll find clear and practical information to help you take care of your health and your families. Let's continue. O stands for difficulty speaking or understanding. Language is a delicate brain function, and any sudden change must be taken seriously. When someone is having a stroke, one of the first signs that may appear is difficulty communicating. And this is very important because if you are witnessing the situation, you must recognize it immediately to act without losing time. Sometimes the stroke affects the person's ability to speak. They try to say something but can only mumble, form disorganized words, or drag their syllables as if they suddenly couldn't coordinate their voice. Other times, the issue isn't expressing themselves but understanding you. You ask a simple question like, "What is your name?" and they stare at you, confused, unable to comprehend what you are saying, as if you were speaking another language. Ask the person to repeat a very simple phrase, something anyone can say effortlessly, such as, "The sky is blue." If they can't repeat it, don't treat it as a minor detail. It is a serious warning sign. And at this point, we're not just observing isolated symptoms, we're confirming that something dangerous may be happening. If you notice one or more of these signs, even if they come and go or seem mild, there is no room to wait. The correct action, the only correct action, is to call your local emergency number immediately. Do not call a family member to come help you. Do not try to schedule a doctor's appointment. Do not wait to see if the person gets better on their own. In a stroke, every minute can completely change the outcome. And you must remember something else. In hemorrhagic strokes, the main symptom is often not trouble speaking or moving, but a sudden, extremely intense headache, so severe that the person may describe it as the worst headache of my life. That pain appears instantly, like an explosion, and may come with nausea, vomiting, or neck stiffness. When this happens, it is a top-level emergency. In the moments after you've already called for help and emergency services are on the way, the minutes can feel endless. But what you do during that time, and what you avoid doing, makes a huge difference. That's why I want to give you a clear and practical plan, including the correct steps and the mistakes you must never make. Step 1. Make the call. Calling an ambulance is not just asking for transportation. You are requesting immediate medical care. Paramedics can begin helping from the very first minute, checking vital signs, giving oxygen, and assessing the situation while heading to the hospital. And the moment your call is received, they activate what is known as a stroke code. This means that by the time the patient arrives at the hospital, a team of neurologists and specialists is already waiting at the door, ready to act without losing a single second. And if the person's condition worsens on the way, that emergency team knows exactly how to intervene. If you try to transport the person yourself, you are completely alone if something goes wrong. Step 2. Record the start time. This is the most valuable piece of information you can provide. You need to identify as precisely as possible when the symptoms began. If you saw the person's mouth droop at 3:15, that is the time. If they collapsed at 9:02, that is the reference. And if no one was with them, you must note the last time they were seen well. For example, you spoke to them at 10 p.m. and they were fine. You found them on the floor at 7 a.m. Therefore, the start time is considered 10 p.m. This time marks the beginning of the 4.5-hour treatment window. With that information, doctors determine whether the most effective treatments can be given. That responsibility is yours at that moment. You are the one keeping time. Step 3. Position and calm. While the ambulance is on its way, the goal is to protect the person. If they are conscious, help them lie down with their heads slightly elevated. Loosen any tight clothing. If they are unconscious or begin to vomit, place them on their side in the recovery position so they do not choke. And above all, remain calm. Panic or yelling only raises blood pressure, which can worsen the stroke. Speak gently, reassure them that help is coming, and keep them as relaxed as possible. Your calmness can make a huge difference. Now, the 3 serious mistakes you must never make. The first, never give aspirin. Many people believe that because aspirin helps with heart attacks, it must also help with the brain. But in a stroke, you have no way of knowing whether the problem is a clot or bleeding. And if it is bleeding, aspirin can make it much worse. That decision is made only by doctors, and only after brain imaging is done. The second mistake, do not wait to see if the person improves. Some strokes cause symptoms that appear and disappear. This may be a transient ischemic attack, a warning sign that a major stroke could happen at any moment. Ignoring it is like turning off a fire alarm while the house is burning. Any symptom, no matter how brief, deserves urgent attention. The third mistake, do not give food or drink. A stroke can affect the muscles used for swallowing. Even a sip of water can go into the lungs and cause aspiration pneumonia, a very dangerous complication. Nothing should go into the mouth, absolutely nothing, until a doctor in the emergency room approves it. Once the patient arrives at the hospital, a race against time begins. The first step is a CT scan. This image shows whether there is bleeding, which would indicate a hemorrhagic stroke, or whether there is no bleeding, which suggests an ischemic stroke caused by a blockage. This information completely changes the treatment plan. If the CT scan confirms an ischemic stroke and the patient is within the 4.5-hour window, we can give a highly effective medication to dissolve the clot. We use a drug called tenecteplase. It works like an enhanced version of the substance your own body uses to break down clots. It is given in a single rapid injection and often works remarkably well. I remember a patient who arrived unable to move half of his body. He received the injection and about 40 minutes later, he began moving his fingers. Watching movement return was like seeing life come back to a wilted flower. And if the clot is large, we have another extraordinary tool, mechanical thrombectomy. A specialist inserts a catheter through the groin, guides it to the brain, and deploys a mesh device that captures and removes the clot. This technique has transformed the outcome for many patients. When imaging shows a stroke caused by bleeding, the approach changes completely. In those cases, no clot-dissolving treatment can be used. The priority is to stop the bleeding and lower the pressure inside the brain as quickly as possible. To achieve this, we control blood pressure aggressively and, in some situations, perform urgent surgery to remove the accumulated blood. All of this happens very quickly, and believe me, every minute counts. That's why I insist so much on recognizing symptoms early and calling emergency services without delay. That first decision changes everything. Now, the most important question, how can you avoid ever reaching this situation? The truth is that most strokes can be prevented. Nearly 9 out of 10 cases could be avoided by taking care of certain aspects of your health. The good news is that much of that protection is in your hands. The American Heart Association summarizes these habits in 8 essential pillars. The first is monitoring your blood pressure. High blood pressure is silent. It gives no warning. The only way to know where you stand is to check it regularly. The goal is to keep it below 130/80. Buying a digital blood pressure monitor is a small investment that can save your life. Measure your pressure each morning and show your doctor the readings. The second pillar is eating wisely. What you put on your plate directly affects your arteries. The best supported pattern is the Mediterranean style. More vegetables, fruits, legumes, fish and olive oil, and fewer processed meats, sweets, snacks, and salty foods. Every time you choose a more natural option, you are protecting your brain. The third is moving more. Being inactive is truly harmful. The goal is 150 minutes of moderate activity per week. It sounds like a lot, but it isn't. Half an hour a day, 5 days a week. A brisk walk, dancing at home, swimming, whatever you enjoy. Every bit counts. Fourth, do not smoke. If you smoke, quitting may be the most important decision you can make for your brain health. Tobacco stiffens and blocks the arteries as if you were filling them with sand. If you need help quitting, talk to your doctor. Asking for support is a sign of wisdom, not weakness. The fifth pillar is monitoring cholesterol and blood sugar. LDL cholesterol is the foundation of arterial blockages, and diabetes accelerates blood vessel damage. The only way to know your levels is through regular blood tests. The sixth pillar is maintaining a healthy weight for your body. It's not about perfect measurements, but about a weight that doesn't place unnecessary strain on your heart or arteries. Losing just 5 to 10% of excess weight already brings major benefits. The seventh is sleeping well. During sleep, your brain performs essential cleaning and repair processes. Sleeping fewer than 7 hours consistently increases the risk of high blood pressure. Prioritize rest, protect your sleep schedule, and treat sleep as a key part of your health. And the eighth is learning to manage stress. Chronic stress raises blood pressure and wears down your health. Find activities that help you unwind: deep breathing, walking outdoors, listening to music, prayer, meditation, or hobbies. Whatever brings you peace. Today you've learned how to recognize stroke symptoms quickly, understood why the time window is so important, and discovered what to do, and what not to do, in those first critical minutes. And above all, you now have very practical tools to reduce your long-term risk. Let me summarize 3 ideas I want you to remember. First, if you notice a sudden change in the face, speech, or strength, do not hesitate. Act immediately. Second, time is brain. Call emergency services and write down the time symptoms began. We take care of the rest. And third, prevention is your greatest strength. Small, consistent changes can prevent a life-altering event. A few months ago, I treated Mr. Alberto, a 68-year-old patient. He recognized his wife's symptoms thanks to a video he had watched just days earlier. He called immediately, and she arrived in time to receive the right treatment. Today she is walking, talking, and enjoying her grandchildren. That is why I always say that sharing information like this can make an enormous difference. I invite you to share this video with your family and friends. It may be one of the most important things you do today. And if you haven't yet, subscribe, comment, and turn on notifications. New videos are posted every day, always with the purpose of helping you protect your health and the health of those you love. Before we finish, I want to invite you to something deeper. Let us give thanks to God for life, for the ability to learn, and for the opportunity to protect our bodies and minds. Every day we receive is a gift. On this channel, Dr. Gabriel Mena and our team are grateful to walk with you and help you improve your habits and well-being. Tomorrow a new video will be waiting for you. I'll be here so we can continue learning together and taking care of what matters most: your health.